Welcome to this week's podcast. Today we're going to talk about communication and I'm going to give you some tips for better communication. Dementia is a complex condition and every person's experience is different. However, many people living with dementia can face similar challenges with communication. Often just a small change that we make in our approach can make a big difference in avoiding communication difficulties or frustration and can help build and maintain good relationships. Your loved one's challenges may include difficulty pronouncing or finding the right words, problems following a conversation, especially in a noisy environment, difficulty understanding humour or sarcasm, difficulty recognising other people's emotions or behaviours, repetition due to reduced concentration or memory problems, tiredness or ill health which may cause a fluctuation in concentration and communication abilities, or stress caused by trying to make sense of the environment, situations and other people. Now I'm going to talk about some common communication issues and how you can help. So, a person with dementia might become more confused, restless and disorientated at certain times of the day. And this could lead up to them becoming more distressed and upset. It's useful to notice these small changes in behaviour so that you can intervene with activities and distraction techniques, which might stop their distress from escalating. So now I'm going to talk about some good communication skills to learn. We communicate a lot through our body language, facial expressions and tone of voice. So if we seem positive, cheerful and confident, then we bring a sense of hope and reassurance to the conversation. But conversely, if we appear resentful or unhappy, we can bring a sense of gloom. So what could we try? Well, we could try stopping what we're doing and focusing on the person and their needs. Try to limit any distractions, any loud conflicting noises, for example. Try saying the person's name when talking to them and emphasize their name. Be specific. Try not to use pronouns such as he or she. Again, use the person's name instead. Maybe touch the person's arm if they feel comfortable with this. Touch is really reassuring. Smile. Speak slowly, clearly, and in short sentences. Listen carefully with empathy and understanding. Give your loved one plenty of time to answer. Maintain appropriate eye contact. Use gestures to act out what you're saying. So maybe mime drinking a cup of tea or put on your shoes in order to help your loved one. Use pictures to illustrate what you're saying, for example, an image of a car or a photo of where you're going. Use simple and straightforward language. And avoid too many open-ended questions or offering too many choices. This can be really difficult for your loved one. So, how may your loved one communicate? How do you react if your loved one's asking for mum and dad and sadly they've passed? For many people, parents mean comfort, security and love. The person might be trying to experience these feelings again. So if you think that your loved one may be feeling insecure, comfort them and offer them reassurance. If your loved one keeps talking about needing to go to work, even though they're no longer working, your loved one might need to feel a sense of purpose, that they are useful and needed. They may be bored. So help preserve their independence by encouraging them to take part in household activities such as dusting or drying up. Even if it's not done the way that you would like it, it will give your loved one a sense of purpose and inclusion. It may be that you can have some hobbies out for your loved one to get involved with, to occupy them. If your loved one is feeling sad or angry and they can't explain why, Well, it could be a sign of unidentified pain or something irritating them about their environment. So what you could do is check the temperature of the room, check for signs of bruising, redness, unusual swellings, or other conditions like arthritis, toothache, headache. You may need to seek advice from a GP about pain relief. You could also validate the person's feelings by saying, "You look sad about something." Your loved one may be asking to go home when they're at home. They may not recognise the home they live in and be looking for a home that they previously lived in. They might also be missing a sense of safety, security, or familiarity. So a tip that you can use is to have some familiar things around, old photos with pictures of the family, old videos, items around the home. Talk to them about the home and give some reassurance. Your loved one maybe cannot find the right word for something. So difficulty finding a word might be a direct result of changes to the brain, specifically the temporal lobe. It could also be due to tiredness, distress, or a noisy environment. So give your loved one plenty of time to reply and use pictures and notes if you can. Listen really carefully to the person and watch their body language. Reduce external distractions such as noise from the TV. Why may your loved one look confused, like they don't understand you? Well, this could be due to a lower level of understanding or difficulty with concentration or too many distractions. So you can help your loved one by being reassuring and gentle. Try saying or asking in a different way. Give the person time. If appropriate, use touch. And again, reduce external distractions. So what do you do if your loved one becomes withdrawn or they're not responding? Well, this could be due to difficulty with understanding or an inability to express themselves due to language problems, temporal lobe damage, or possible depression. So face your loved one, gain eye contact, pace the conversation so it's not too quick. Don't give too much information or ask too many questions. Investigate whether depression could be an issue for the person through a visit to the GP. What do you do if your loved one says, "What are you doing in my house? Who are you?" Loss of recognition of familiar people, faces, and environment could be due to fear or memory changes. If this occurs suddenly, it could be an indicative sign of infection or physical ill health, causing some confusion, which needs medical intervention. And we've discussed delirium previously. Try to understand your loved one's reality. Remove yourself to another room for a few minutes and re-enter calmly and say something like, "Hello, I'm back now, lovely to see you." Finally, I think it's really important to realise that communication is complex. The suggestions I've made here may work with some people, but not with others. People living with dementia can often understand far more than they can express. So always involve the person in communication using the hints and tips. And remember, we've discussed delirium before, but if there's a sudden change for your loved one living with dementia and your loved one's more irritable and confused than before, visit the GP to find out if there's another reason for this. They might have an underlying infection, constipation, dehydration, be in pain, and have difficulties with the physical health. So this will need treating as soon as possible. So thank you again for listening. I've left my contact number here and the helpline number should you need it.